Welcome to Public Health Cares, a podcast produced by Public Health, Dayton and Montgomery County, and dedicated to keeping all of Montgomery County, Ohio, a healthy, safe, and thriving community.
Thank you for joining us for today's episode of Public Health Cares. I'm your host, Dan Suffoletto, Public Information Manager, and today we will hear from John Payne, Men's Health Supervisor for Public Health, Dayton and Montgomery County. Thanks for being with us today, John.
Thanks for having me.
Well, I think the first thing we want to start out with is why is a dedicated men's health program important in public health, and what type of challenges do men face in healthcare in general?
Men face unique healthcare challenges due to a number of factors. Those would include like higher rates of certain diseases, barriers to care, and societal expectations. Men have higher rates of cardiovascular disease, which includes heart attack and strokes. And men also have higher rates of some cancers, type 2 diabetes, and other health conditions.
And that's something that, we'll talk about a little bit later, but sometimes men tend to ignore routine types of things that they need to do. And that's one of the things your program is addressing, correct?
Correct.
So the other thing we want to talk about is what are some of the most common health issues affecting men in our community, and how are you addressing those in the community?
Some of the most common health issues affecting men in our community is heart disease, prostate cancer, diabetes, and mental health issues. Men are suffering from depression, lung cancer, high blood pressure, obesity due to lack of movement and exercising, and chronic respiratory disease. Our program pretty much encourages men to educate themselves on when and how often they should be getting their health screenings. And, early detection is a big step in preventing some of that.
And when we talk about heart disease and men's health in general, I always want to make sure we don't forget a message about smoking. Smoking is the most unhealthy, dangerous thing you can be doing. And if there's men out there listening, well, if there's anybody out there listening for that matter, and you're smoking, please give us a call and we can link you with tobacco cessation programs, either through public health or through other agencies. Public health does have some free programs to help people, particularly pregnant women and people living with pregnant women. So that would include the men living with the women, to stop smoking. And that is something that we cannot overemphasize enough. Right, John?
I absolutely agree.
So let's get back into your program specifically. One of the ideas around your program is to not only look after the health of men, but also the health of the family and moms and babies. And can you tell us a little bit about how men can support maternal health and ensure better health outcomes for both moms and babies?
Men can support maternal health by being involved in decision making. Of course, we hope that the ladies are listening to their man, providing practical support and advocating for health promoting behaviors. Practical support is to provide financial support, offering transportation to healthcare appointments, being present during labor, and helping with household tasks and chores. Just being supportive of that mom.
And you mentioned some things there that when you talk about health, it goes beyond just things like, do I smoke or do I have diabetes? Really, how you live, your lifestyle, and what you have access to in terms of healthcare, all of that plays a role in your ability to be healthy and stay healthy. So you talked about things like jobs and linking people. So you do link men and help them with being able to get a job if they don't have a job?
Yes, we support men in pretty much a holistic. Our program is a holistic program. So if they are looking for work, we help out with work. If they're trying to get back in school, or maybe they didn't graduate from high school, we have a link with a GED program. Just any barrier that a man may face, if we can't do it in house, we can link them to services here in the community.
Right. So you're like the first door for men. They can come see you, and then we can help men if we have a direct program from public health. But if we don't have a direct program, you have resources throughout the community that then men can take advantage of.
That is correct.
How are you currently getting a lot of the men in your program? What are some of the ways that you reach out, and what are some of the types of people that can get into your program? Well, anyone can get into your program, but what are your most popular ways right now in terms of people getting into your program?
Yeah, we do a lot of community outreach, so you'll be seeing our guys out in the community at different events. Some of the women's programs where they have pregnant moms, we try and make sure that they have our information so they can share that with the pregnant moms. We have referrals coming in from the juvenile courts, child support, things like that, things that we help men with, such as child support. They have our information to link men to our program. And of course, word of mouth, some of the guys that have already been through our program have been able to, spread the word, and we get referrals that way as well.
Right. And you mentioned you have a team out there in the community. How many people are on your team?
There's myself and two other certified community health workers,
Okay.
Brandon McLemore and Abraham Marone.
Okay, Brandon and Ibrahim. Oh, very good. We appreciate everything that they do. And you mentioned certified community health worker, right? That's a special learned skill, correct?
You are correct. We go through Ohio State University. It's certified through the Board of Nursing in Ohio, so it's a pretty strenuous curriculum, and we are certified.
Okay, great. So we're just not rolling anybody out there. It's like people who are directly trained to help, and they have different ways depending on the man's situation that they can help. So we want to get back into a little bit more about men and how they can help impact the health in a positive way for children and foster stronger, healthy family dynamics. What are some of the things involved there?
Well, a father being active is, one of the most important things. If we have an active dad, it pretty much helps out all the way around. A father's active involvement significantly impacts the child's health, contributing to positive outcomes in cognitive, social, emotional, and physical development. And, there's been research that showed where children that are engaged with their dads tend to have better overall well-being, higher self-esteem, improved academic performance. So just all the way around, if the dad's engaged, we see the kids doing better all the way around.
And we don't want to overlook this, and hopefully it's coming through. But when we say father, we don't necessarily mean husband. We mean the father. So whether you're married or not, there's a role you play and should play, and we want to make sure that you have every opportunity to be successful. Correct?
Yes, we have single dads in our program, just because they're, like you mentioned, if they're not married, that's okay, because we do promote co-parenting, whether you're in the home or not.
And you do have several different initiatives that you're running. One of them is the Fatherhood Club. Tell us a little bit about that.
Yeah, the Fatherhood Club, we do that once a month. It's the last Monday of the month, and we gather with the dads and just talk about parenting overall. And some of the dads are dealing with the same issues, so they're able to talk to each other about those things. And the professional help in the room is always a plus. That way, they can get some professional information as well, just on overall parenting.
Right. And we want to remind people that, this is open to fathers. There's no charge. Anybody can come in and learn from the program. It's very low pressure. You can just show up. If you want more information, you can give us a call here at 225-5700, and we can provide you with more information. Also, we want to let you know that all of this information is on our website at phdmc.org. John and his team have a lot of great stuff going on, so you want to go to our website and check to see all the things we're talking about here today. If you give us a call at that main number, we can link you directly with John should you have any further follow-up questions. Once again, that's phdmc.org. As you're listening right now, you can go ahead and look at it while you're listening, or after, if you're in the car listening or whatever, you can go home and check that out at a later date. So we mentioned the Fatherhood Club specifically. You have a couple of other things going on. like 24/7 dad. What's that all about?
A 24/7 dad is for, in my opinion, for men that already have children. It's just to give them some more guidance on how to be a better dad. And 24/7 dad is it's a curriculum that has been accredited through the National Fatherhood Initiative. So it's a really good program. And like I say, it's probably the best fit for somebody that already has kids.
All right. And then we have nurturing fathers.
Yeah, nurturing fathers. That's one of the classes that we have, and I would say that one is more for a new dad or expected father. They teach you from the basics of what it's going to be like waking up in the middle of the night, assisting with diaper changing and feeding, that kind of stuff. So how we recommend that, yeah.
Okay, so new dads there, that's great. And then on my shoulders.
Yeah, on my shoulders is another one. It's like in my opinion, it would be a combination of both 24/7 dad and nurturing father. So it can be for any dad, and it's a really good one as well.
And then finally, inside out dad.
Inside out dad is for returning citizens. If a father has been incarcerated, sometimes it's tough coming back from being in jail and having to come back out here into society and be hopping right back into parenting, and especially if they've been gone for 2 or 3 years or more. The kids have grown, and it's a little bit different from parenting from being inside versus outside. So that one is to help them adapt to coming back home.
All right. So a lot of great programs there. Again, give us a call, 225-5700 if you need more information. Otherwise, you can go to our website and our events page and or John's specific page on the website, the Men's Health Program, to get further information. So we're talking about men and interacting with children and the family, but then there's also the part about men's health that just deals with the individual health of the man specifically, right? And men can sometimes be hesitant to seek medical care, to participate in health programs. So, what are some of the ways you try to educate and overcome that?
Some of those issues have come from societal norms, and when I say that, I mean like acknowledging the cultural expectation of men being tough and avoid language that could reinforce the idea that seeking medical care is a sign of weakness. A lot of men just like blow the doctor off. I'll be okay. Like back in the day, you get a cut on your hand, they like throw some dirt on it, you'll be fine. Yeah, well, we don't go that way. So no, we try and encourage the guys to go make sure they get their annual physicals, dental exams, and
Right.
their health screenings.
Right. It's not about weakness. It's about being healthy makes you stronger. So you're strengthening yourself by taking care of all of your routine things that you should be doing, and then also certainly addressing any emerging healthcare needs that you may have. I do want to mention if you're in a situation where you may not have insurance, not know what to do about that, we do have someone here at the health department who could help you with Medicaid sign up directly. So if you want to give us a call here at 225-5700 about that, we can also, it's not part of John's program directly, but obviously, men and dads out there listening, anybody listening, if you need that help, I want to make sure people are aware of that. So, John, we also have a situation where there are health disparities, and there's unfortunately health disparities in pretty much every health area, and men's health is no exception. So we have some disparities. Can you talk about some of the factors and what some of those disparities mean?
Yes, significant disparities in health outcomes exist based on race, income, and other factors, with minority populations and individuals from lower socioeconomic backgrounds. They often experience poor health compared to, their counterparts that have higher income. And our program actively addresses these gaps by focusing on increasing access to care in underserved communities.
All
Uh,
right, that's great. So, go ahead.
Yeah,
Well,
so we just try to make sure that our guys in our community are getting the same, type of healthcare treatment, and if they don't know where to go, then we can direct them.
right, and we want to emphasize that this isn't someone sitting behind their desk all day just answering phone calls. It's the guys are out there in the community reaching out and trying to speak to men where they are, correct?
That is correct.
So that's something that, we try to do here, not just in the men's health program, but in many of our outreach programs. In the name outreach, you need to go out and you need to be available and accessible. So we try to do that. And John's team, as well as other teams at Public Health, they can provide you referrals to a lot of different things. So if you should come across John's team or John in the community, they can link you to a lot of different things, whether or not you're a man or not. Feel free to come up to them if you see them out at a booth setting up, and maybe you're not a man or you're not a father. Stop by, say hi. They can tell you what they have going on. They can answer any questions you may have about other things that either public health does or other community type services. That being said, John, we're about ready to wrap this up here. Is there anything else you want to add for our listeners here today?
Yeah, Dan, I just want them to know that our programs are free. So money should not be an object when it comes to your health. So our program is free. We can, like I said, link you up to any other services that you may be looking for. And we just want to make sure that you're getting your regular physical, dental exams and health screenings as needed. Because at the end of the day, chronic disease prevention is our goal.
All right. That's great, John. Thank you for joining us here today.
All right. Thanks for having me.
This has been Public Health Cares. I was your host, Dan Suffoletto, Public Information Manager for Public Health Dayton and Montgomery County. My guest has been John Payne, Men's Health Supervisor here at Public Health. For more information, again, you can visit our website at phdmc.org, or you can give us a call at 937-225-5700. Until next time, stay healthy, Montgomery County.
You have been listening to Public Health Cares, a podcast produced by Public Health Dayton and Montgomery County. We invite you to subscribe so you do not miss any upcoming episodes.